Dr. Heather Frodge. I'm the owner of Town Dentistry in the Atlanta area. We have 2 locations. We opened our first in 2012 and our second in 2015. We've grown from 1 practice to 2 with 4 doctors and have used Curve all along the way. The main benefit for us that we see clinically is the charting. For our new team members who come on board, it's easy training. Fewer mistakes are made. The codes automatically populate with the Curve system. And for patients, treatment planning has been wonderful because they can see exactly what we're going to do. They can understand the diagrams and understand more about what their treatment looks like. Case acceptance has been improved because of that. Curve has helped our business grow tremendously. We started with just me and 1 practice. It was going to be that way forever. And then as we started growing, I realized that I loved the business side of what I do. So when we opened our second office, Curve became part of that easily. All we had to do is add the providers. We didn't have to add servers or anything, so that helped keep our overhead lower. And then we've been able to add our providers as we've grown into 4 doctors and 2 practices, and we're continuing that trend. So it's really been beneficial for us to just have that constant as Curve with our software program. As a business owner, Curve has helped me to make critical decisions. One of the most recent ones was choosing insurance plans that we needed to eliminate in order to see more new patients. To increase our capacity, we had to make some room. So we were able to run reports that showed the number of patients who would be affected, who they were, and the revenue that would be affected by that. The paperless capabilities of Curve has helped us for a long time. We've been using it for a while. It helps us stay on track. Our patients are required to complete those forms before they come in, so we aren't slowed down when they're in the practice at their new patient appointment or medical history updates. All of that we do remotely. And during COVID, it's been critical. We become a touchless office, so we can send this to our patients at home, or they can complete it in their car on their phone as they're waiting to come into the office, and we don't have to hand things back and forth to them. With Curve and the remote access that we have, we've been able to schedule from wherever we are. We have an employee who works with us out in Texas, and we're in Georgia, and she's able to get on, and it looks like she's calling from the office, and everything goes smoothly there. There are days that we've had to close the practice due to weather. We can call our patients and get them rescheduled right away, and it's been very effective for us to keep our practices running as smoothly as possible. As a practicing dentist, sometimes my treatment plans change when the patient's in the chair. The great thing about Curve in that respect is that as soon as I make the change in the system, the front office knows that right away. And when I have the patient go up to check out, the front office already has their treatment plan ready. Any changes that have happened, they're ready and have everything calculated for what their copay may be. So that's made our life a lot easier. Curve's customer support has been great for me. When we first opened Town Dentistry back in 2012, I was the main one calling with any problems we could have or any questions we needed to have answered. And during that time, I would be in between patients and someone picked up right away. Often it was the same or a group of the same people that I always spoke to. They knew me and they were able to help me right away and get everything solved quickly. Another great thing that I've loved about Curve is when there's a suggestion I have that would help me run my practice smoother, they were very welcoming to any ideas that I had as a practice owner, and I've seen some of those suggestions get implemented, which is really neat. So as Town Dentistry has grown from 1 to 2 practices, from 1 doctor to 4 doctors, from 1 employee to 25, I've been able to start working from home when I'm not with patients, especially since COVID came around. Now I can be home with my toddler and I'm able to do the things I need to run the business effectively, keep our growth on track, all from home. And it's been so critical for me to be able to be there and be a mom too, and to be able to keep these businesses running as if I'm right there in the practice.